Welcome to Pharmacy View podcast, where we provide regular interviews with pharmacists and key people within the Australian pharmacy and associated industry. In this stream of podcast episodes, we discuss aspects of technology or business operation and how each area interacts with guests' current role or pharmacy-related business. I'm your host, Scott Carpenter, and my guest today is proudly brought to you by Shopfront Solutions for all your digital, shelf and marketing needs, part of the Arian Technologies Group. Pharmacy Addressing Loneliness and Social Isolation is the first international network of individuals and organisations across the pharmacy industry that are passionate about the health of their specific patients. My guest today is pharmacist Jenny Kirschner from PALS, Pharmacy Addressing Loneliness and Social Isolation. Welcome, Jenny.
Hi, Scott. So lovely to be here. Thank you for having me.
It's great. I've been really looking forward to this chat. I know we had a bit of a deferment over the Christmas period and January period, but we're here and really looking forward to the chat. Now, whilst you and I have never met in person, we've had the great wonders of technology that have, introduced to us as each other in a technological sense. And I'm no doubt that within your own pharmacy arena, there'll be quite a few people that will be listening today that will know you. But for anyone who's listening today that may not know, who is pharmacist Jenny Kirschner?
Great question. I think I should start by saying my dad's a pharmacist. So my first introduction to pharmacy was actually when I was very young, and I did the Christmas stand out the front and I would do the window displays. So I always felt like pharmacy was very creative. And so I've had quite a colourful career in pharmacy. I started off in some retail pharmacy. The lady that I did my internship with was actually the president of the PSA at the time, and it was a tiny little pharmacy, but she really taught me the value of connection with customers and how every customer deserves attention. And also as a preceptor, she was really invested and involved and concerned about my well-being as a pharmacy student. So I started off in retail pharmacy. I worked overseas in London, and over there I actually got into some hospital pharmacy, and that was a wonderful experience. Again, I met a lady there who was wholeheartedly captivated by clinical pharmacy, and she kind of opened the door to clinical pharmacy to me. So then when I got back, I worked at the Alfred Hospital actually as a clinical pharmacist for about 7 years. 5 of those were ward-based services. And the last 2 years were project management around antimicrobial stewardship. So that was really terrific to have a bit of retail experience, to have clinical experience, which I really loved, and then also to do project management and change management in a large hospital, getting consensus around how antibiotics would be used. You know, from that place, I actually really felt that it's important that we develop skills as a pharmacist to engage with people in a way that understands them and helps them motivate them to change. So what I did was I went and did some health coach training. And so pharmacists might have heard of health coaching, but really there's skills to be able to what's called motivational interviewing, engage with people, understand their why. And when you understand their why, you can then go and help them motivate them to change, or help them structure some plans and strategies and goals to change. So I also have worked for Diabetes Australia as a health coach in a range of lifestyle modification programs. So that's telephone health coaching, trying to reduce the incidence of cardiovascular disease and diabetes. And then from there, I'm just having a think. From there, I actually did quite a bit of travel, but I also it's a little bit off pharmacy, actually. I actually, with my partner, made raw organic chocolates when we were living in Sydney, and we distributed those in Melbourne and Sydney, and also imported a superfood from Africa and distributed those also. And I guess the importance of this is that I think as a pharmacist, it's really important to understand all sides of what business is about: imports, exports, pricing, relationship management. So that's just a bit of an interesting throw in. I'll share one more because I feel like this is very much related to what we'll talk about a little bit later, and loneliness. When I had my 2 children, I was at home quite a bit, and I always loved dancing, and there wasn't really a place to go. So I created a series of events called Mother Funkers, which were daytime dance parties where babies could come along with the mums. So really, if you break that down, what I did was create opportunities for community to connect. And it was really a wellbeing and mental health initiative for mothers to come along. And I ran a series of those and had a lot of people attend. And it was fun, but it really served the intention of connecting people for their wellbeing and health. So everything, I think you can see along the way, whether it's raw organic chocolate to health coaching to dance parties, is around the health and connecting individuals. And I'll share my most recent role. I also work as a National Health Programs Pharmacist, digital and clinical services. So as you're very well aware, there's been such a kind of a wave of technology, and I really feel like pharmacy needs to be open and upskill themselves to be part of that. So I've recently finished some product management course to be able to help facilitate bring digital health programs to clinical services in the pharmacy. So a bit of everything.
Look, that's great. And look, I'd love to talk about chocolate because I'm going to admit that it's one of my vices in life. I do have a metabolism that can, process chocolate fairly well. There's people that are envious of the amount of chocolate I can process, but with that comes a lot of exercise and to a point, I guess, sugar replacement in terms of what I do. For those that know me and know what I do, you would understand why that works for me. That's a great background, and you're right. There is a theme there around connectivity of people and particularly social interaction. And stating the obvious is that social interaction we know is good for health, and there's no doubt about where that lies. And I guess we move now into PALS, Pharmacy Addressing Loneliness and Socialisation, to a point. I see technology and would love to chat with you about how this works with the PALS group, but I see technology being both a help and a hindrance because we know I could just be as simple as introvert and extrovert. And I know there's many different psychological profiles, but if we just stick with those two, if you're an introvert and you don't necessarily like getting out, then technology, I guess to a point, creates a platform where you can go and hide fairly well and still get what you need, I guess, from an interaction point of view. On the reciprocal side of things, in what I call the last 2 and a bit unprecedented years where we've all been in some form of lockdown or social isolation, technology has become multi-platforms that has allowed people to interact. And I know even within my own network, we had a fairly active outdoor group that we just couldn't get out and do the things that we were doing before. So once a week, we would actually have a Zoom group meeting, or what I call a Brady Bunch meeting, for those of you that know what that is, where we would still interact and talk to each other. And so for us extroverts that needed the social interaction, that needed the association with other people but couldn't get it, so technology helped us with that. So talk to us about PALS. How did that come about? I think you've already answered it in part, but let's talk specifically about PALS and how it works and how it's working to help with the healthcare of patients and clients.
Sure. So I've been following the topic of loneliness for over a decade with an interest that really stemmed from my own personal experiences with loneliness. So loneliness is a really interesting thing. It's quite a private thing. So to the outside, people can seem very happy and outgoing, extroverted or introverted, but loneliness is a subjective feeling that you don't have the quality and quantity, or really the quality of relationships that you're after. So I, from my own personal experiences, went exploring and thought, what is this? How do I unpack this and make sense of what's going on? Or is this just an uncomfortable emotion and, not to pay too much attention to it? And at the time, 10 years ago, there wasn't that much information out there, but then COVID happened. And what we found is there was this global experience of loneliness. And for those who hadn't experienced loneliness before, they had more empathy and understanding of those who otherwise might experience loneliness. So it kind of opened the door for this conversation. And so I was thinking, what is the best place that I can impact here? How can I make the largest impact? And what I realized is pharmacy, be it hospital pharmacy or community pharmacy, are at critical access points to patients. And it's really important. It's actually, I would suggest, our professional responsibility to start to upskill ourselves and learn about the science of loneliness so we can start to recognize it in our patients and respond. So at the time when COVID happened, I thought, now's a good time to be proactive from a pharmacy perspective. So I established PALS, as you mentioned, which is Pharmacy Addressing Loneliness and Social Isolation. And really kind of thinking through the roadmap of PALS, in the first instance, we actually need to make sure that the whole pharmacy industry understand what loneliness is and understand that it has not just psychological impacts, but health impacts. So I'm going to reel off a couple of statistics, and I've got some articles that people can read to see the real robust evidence. But there is evidence to show that loneliness can increase your risk of premature death by 26%. Now, that's the same kind of risk as you have with obesity. We've got things like increased incidence of cardiovascular disease, of stroke, of increased risk of depression. There's a whole stream of effects that loneliness have that you just kind of wouldn't think about unless you've looked into it, because we're not actually discussing it enough in Australia or globally. What you'll see is in overseas, like in London in 2019, they appointed a Minister of Loneliness. Japan did the same in 2021. The WHO is now talking about plans to have a social connection index. But in Australia, we don't have a clear national strategy. So I just thought, in coming back to PALS, I actually feel like the pharmacy industry is often overlooked in conversations around health initiatives. And this is another example where there are people getting together globally and in other countries, and pharmacy is not represented there. So this was an opportunity to put our hand up and say, we actually can take a leadership position in this, and it's critical that we are part of this conversation. So I started to reach out to universities like Monash University Pharmacy and Pharmaceutical Society and the Pharmaceutical Society, and I've been started to give lectures to students and to staff to make sure that we are across this new health crisis. It really is a health crisis. There's a doctor, this general surgeon of the US called Dr. Vivek Murthy, and he said that this is a crisis like at the scale of the opioid epidemic and the obesity in the US. I mean, this is the kind of scale. In Australia, we're looking at a third of the population, so 36% of the Australian population saying they're experiencing loneliness. If you think about that, that's larger than the number of people suffering diabetes in Australia, right? So this is a huge crisis. And so really PALS came about to say, hold on, we need to do something. We can do something. We all know the patients in community pharmacy who come in just for a chat. They spread out getting their repeat prescriptions because they're coming in to connect. And, talking about the digital landscape, I've been following that, as I mentioned, and we are seeing really convenient models of healthcare where people can sit on the couch, jump online, speak to a doctor or fill out a form, get a prescription and have it sent to their door, and they don't have to move anywhere. Now, whilst that's got its advantages and convenience, it's actually chipping away at the incidental chats because the patient is no longer seeing that doctor who might have been the only person that they see. And so in a community pharmacy setting, as an example, we are seeing patients more than their GP. We are seeing patients in their everyday life, not always in the acute setting. Maybe they're coming in when they're well. And that gives us this really unique opportunity to, as we do, engage and know people really well. So my call and the intention for PALS is to educate the pharmacy industry, to have pharmacists screening. There are validated screening tools for loneliness, and this could be added on to medication reviews, meds checks, the HMR pharmacists, the embedded care pharmacists, the hospital pharmacists on discharge. We could all be having, it's an easy 4-question validated screening tools, and then being able to refer patients in. In a moment, I'll come back, perhaps if we've got time, Scott, to talk about social prescribing. But staying with PALS, what I think we're really trying to do is make sure we educate the pharmacists, help everybody understand that this is our responsibility as part of lifestyle counselling and holistic personalised care, to be talking about social health with patients.
Yeah, no, that's a really good overview. And as you were talking there, I was thinking about some experiences even within my, career history with pharmacy and my family. And You're right. In the times that I've spent in different pharmacies around the country, and there's been lots of times and many different pharmacies, I guess what I've observed from the pharmacy team is that the pharmacist might be the person behind the computer screen dispensing, but you're right. The average age and type of client coming in is coming in on a regular basis, has a connection with that pharmacist and pharmacy team. Like I'm aware of instances where some customers will only come in on a certain day because the part-time pharmacist works on that day and that's who they've got a connection with. The even greater one for me, which I discovered after a couple of years, is how important the pharmacy assistant and dispensary technician team are, because if there was ever anyone that knew what was going on in the community, it's possibly the senior pharmacy assistants, because they're talking with the clients on a regular basis, they're seeing them, and they're the ones that, to a point, have got a little bit more time to perceive, hey, Mr. or Mrs. didn't seem themselves today. And now whether that then progresses into a follow-up phone call or a follow-up or discussion or a follow-up chat, I guess is what comes out of the value of that team. But certainly within the pharmacist perspective, the last 2 or 3 years has changed the whole operation model. The outcomes are not differently, but with the extended services and the availability of pharmacy through the last 2 or 3 years, where many other businesses you couldn't get in through the door, that aspect and that value of pharmacy has become even more important. And if I can, just one more thing was that, from what you were saying, my mum passed away a few years now, and my dad's on his own, and they've always been very active, and they've been tied to their pharmacy. And dad's a little bit less active these days. He still gets out and about, but he will always tell me whenever I chat to him about his weekly visit from the pharmacy lady who brings his dosette pack. And he is lonely, he is on his own, and he sees and values that relationship. So the message here to pharmacy teams is that you possibly do all of this because of who you are and the empathetic people you are by nature. But there's, if I've listened to you correctly, there's this opportunity to connect at an even greater level without much more effort. It's really an awareness in yourself, isn't it?
Absolutely. And I think you make a very good point. This was pharmacy addressing loneliness and social isolation, not pharmacists addressing loneliness and social isolation. I really think it's a broad industry approach that we need. And even just another example is there is research showing that loneliness can affect medication adherence, which, if you think about it, makes sense. If somebody doesn't have the right social support, they might not be able to get to the pharmacy to get their medication and pick it up, or they might not be motivated to take it. You just feel a bit down and feel a bit lonely, and you don't have someone encouraging you to take it. So this is, the pharmaceutical industry needs to consider this also. If we're going to improve medication adherence, we're going to improve health compliance, we actually kind of need to focus on this, because, as you say, there are many people living alone, and being alone in itself doesn't mean you're lonely. There is a difference between being alone and loneliness, but one's objective and one's subjective. But it's actually yes, to your point, there are lots of people living alone coming into the pharmacy or feeling lonely. And loneliness, we should flag here also, doesn't just affect the elderly. It can affect everybody, every age. In fact, some of the higher risk age groups include I think it's about 18 to 25-year-olds. And then again, when you're in your 80s. So there are particular at-risk groups. But yes, I think you're hearing my point that we do it probably intuitively by nature. I know a pharmacist, who happens to be my dad, who, does deliveries, and then, he goes in and he ends up changing the light bulb for the person. And, there's somebody who's living alone and she's in a wheelchair and she doesn't kind of connect with anyone. And, he's drawn in to have a little bit of a chat. And I've always thought that's what pharmacy is about. I've always felt like a little bit of a square peg in pharmacy. I've done all these interesting things. And it wasn't until this COVID thing happened where I realized actually the core of who I am, which is about connecting people and caring for individuals for who they are and their social needs and well-being, is absolutely pharmacy. It's just we haven't kind of yet fully embraced this. And interesting with the PAL. So PAL is an initiative to get lots of pharmacists globally involved. And I've connected with pharmacists from Egypt and the UK and the US and everywhere. And getting people who are interested in understanding this. And most recently, I had a gentleman from Germany reach out, and we had a little interview, and he wrote an article about this, because one other thing to flag is loneliness can affect staff also. There's workplace loneliness that's very prevalent, especially when you have pharmacists who have been through hard times with COVID, working long hours, not necessarily, seeing their families or being able to share that. And the effect of loneliness, again, the wider effects is health, and then loss of productivity and effectiveness, because people are staying home because of health consequences, and lack of motivation, innovation, reduced creativity. These are impacts that have been documented around loneliness. So I think a key call out here is loneliness is not just, that's an uncomfortable emotion. This is a modifiable risk factor and a significant health risk. And so PALS is here to say, hold on, pharmacy industry, we need to step up. And even presenting at the Pharmaceutical Society of Australia conference last year, it was amazing how many pharmacists hadn't thought about this, but were so touched and reached out to me after to see how could we be involved. I even met a pharmacist who, during COVID, created what was called the Pen Pals program. So she had a student, and she said to the student, write a letter to the doctor. And the student said, I don't know how to write a letter to the doctor. And so then she thought to herself, you know what? I used to do that all the time with a buddy, with a pen pal. That's what I'm going to do with my elderly customers who I'm seeing who don't have contacts. So she organised with the local school a whole lot of letters to be written, and she was the conduit and connected those anonymously with her patients. And she said it's still going, and that you interview people and the people say, this was the thing that kept me going, that letter from my pen pal from the pharmacy. So as you say, a simple measure. I mean, this is simple. This is not complex pharmacy clinical interventions or services. This is something simple that is life-changing, absolutely life-changing. So PALS is an invitation to anyone and everyone in the pharmacy industry, from hospital to community to embedded care pharmacists, to appreciate that we have a role to play in this. And I hope that PALS is that it really serves as an education tool in the first instance, to make people kind of wake up and look at the evidence and the research to understand what loneliness is. And then, as I said, from there, we can start to embed screening tools into mes checks. We can get referral pathways to different initiatives. And there's a lot that we can do. But I do think we just need to be aware of it to start with.
A very valid point. And again, as you were chatting there, I was just jotting down a couple of notes. Now, in the show notes that we'll attach to the podcast and the YouTube video, we'll include your contact points. But I know even from my own research, and you mentioned there your presentation at the PSA conference, so there will be articles that you've written, there will be potentially copies or files of your presentations online that people can search you out, or ultimately people can actually just shoot you a little note either through your contact points. We'll certainly include LinkedIn as a contact point for you. But for anyone listening today this has hit a chord with them and said, actually, maybe this isn't as hard. Maybe I can find the 5 or 10 minutes to engage with my team and get a greater interaction within my community pharmacy group. What you're talking about today is mental health is as important as medical health, because it's hard to recover from something if your head's not in the right space, isn't it?
Yeah, and I think that's really interesting. In fact, loneliness is not listed in the DSM, the manual where the psychiatrists look for different diagnoses. So it's not actually considered a mental illness, which is really important, I think. So it's kind of an evolution of that. It's mental health, it's societal, it's a social health, and it's a societal issue. So I think it's actually it's important to have that understanding of the difference in definition, because people who are lonely, when they're experiencing loneliness, can feel a real sense of shame and that there's something wrong with them, and that kind of sits at the core, and that stops them getting help. So, as you said, the empathetic pharmacist who is experienced engaging with people and connecting and develop rapport, they need to bring their delicate nature in to have this conversation, and they have the trust already established, so they probably can, broach the conversation. But it is important to, it's mental well-being, I would say, and social health. But it's important to distinguish that it is not a condition. Every human, it's a very human experience to have. It's just that we need to move to recognize that if we are not feeling connected, there are impacts on that, and not to ignore that, but we need to be proactive and address it.
From that perspective. No, look, that's great. We are going to move on in a minute just to the technology platforms that you've been involved with. But before we do, in terms of PALS, is there anything that we haven't discussed? That's been a really good chat. It's certainly an area of interest to me and opened my mind up to a few other things. But for, again, our listeners, have we covered everything off that was on your little list?
Yeah, there is. I do have a little website, which is, I think it's called PALS Global Network. And I'll share that link with you. As you said, it's got the articles there. I really think, to be honest, I've worked hard. It's a hustle. Okay, I'm going to tell you the truth. It's a hustle to get this on the agenda, because there's no, at this moment, remuneration for a pharmacist to do a screening on loneliness. But I think the difference here is people understand this. It pulls at the heartstrings. You know those customers who come in. And if we empowered pharmacies and pharmacists to know that there's little things that they could do, then I think that would go a long way. So the only thing I'd say left is, if you're interested, if this is something that resonates, if it pulls at you to do more, please reach out. As you mentioned, Scott, I'm happy to do, webinars for pharmacy staff. I'm happy to share the resources I have. Often, I do presentations within the first minute. There's quite a few tears in the audience. But I think that's because people connect to this. People know somebody, whether it's yourself or your brother or your mother or a patient or a friend, you'll know someone who's experiencing loneliness, and it just, it's a tangible feeling in your heart that, that's not a nice feeling. What can I do to help them? So that's the last thing. If there's anything, please reach out. If there are opportunities to present or to get in front of pharmacy students or industry, I am more than happy to put up my hand and come and provide that introduction to loneliness.
That's excellent. And I think that's a really good segue then into the technology platforms that you're involved with. So you mentioned in part of your history that you were involved in telephone health coaching. And the reality is that we still use the phone today a little bit, but I'm finding, certainly from my perspective, I tend to text message to people more than phone. And now, again, it's possibly just because life's become so busy, and it's a quick, hey, what do you think about this? Or, can I help you with this? Or can you help me with that kind of thing? So that's where the text messaging works in a very busy lifestyle. But from a coaching and an interaction point of view, what are some of the technology platforms that you're involved with?
So in the past, when I was using the health coaching, it was Salesforce, and there was, I think it was just Zoom also. We kind of at the time just used Zoom. But more recently, it is definitely WhatsApp. That's kind of, a place where I'm connecting with people. It's still Zoom. There's Google Meet. It's actually, shared documents. That's another, it's not the communication tool, but it's a way that we're collaborating. So collaboration tools like that. And I myself use Trello quite a bit, just to to plan different kind of strategies and what we're doing. PowerPoint, again, for presentations. So it's just the standard ones that I'm using. But if I can, I'm just going to extend this a little bit, this conversation, broaden it a little bit, because you make a good point about technology and PALS and loneliness. There are so many interesting things coming out as potential solutions or potential ways to address loneliness. Things including AI, including robotics, and it's a really interesting space, because in many ways this technology and the pace of life has eroded a lot of connections. In some ways, there are tools that are helping people connect. So I was recently on a telephone call, and there are people out there now creating AI conversations just to check in with people. There are little robots that you can get who are learning about you, who are driven by empathy, who initiate conversations with you, like, how was your day? Or how was your lunch? Or have you taken your medications? So there are a lot of these things coming. There's even little dogs. You might have seen them. They're like robot dogs and robot cats, but they look real and they breathe in and out. They're companion robots. And so I think it's important in this, it's part of this, to take you on a bit of a branch, but it's kind of along the same topic. I think we're going to find the ways of connecting are changing. And, we even have conversations around with the people involved in PALS and social prescribing about prescribing non-medical solutions for people like volunteering or, going to a dance class. When we talk about this as part of PALS and the umbrella of solutions to address loneliness, people are talking about the metaverse already and pharmacy and the metaverse and how, customers are going to be able to engage in that way. So I actually think it is open door at this point. How people are, the acceptability of a lot of these things is up for question, but they're all coming out fast. So it was a bit of a left turn of your conversation, but a bit of everything. Bit of everything's coming. AI, robots, and I have a vision. I have a vision in the future. There could be in the pharmacy a whole new merchandise category, which is social health, and you might see those robots there, and you might see. You guys might have spoken about digital therapeutics. Maybe there is this kind of coaching program that's digitized. That's a therapeutic that goes out with a medication and that helps someone reconnect and develop social skills and then prompts them to go and connect with other people. We might just have a social health merchandise category in the pharmacy one day. And I think that will be driven quite a bit by technology and also quite a bit by a person just sitting there available for a chat.
Jenny, that is fantastic, and you're right. You and I think our brains went to the same place at the same time in terms of that, because pharmacy is the community hub for so many things with people, depending on whether it's one pharmacy or multiple pharmacies in a town or a suburb. That is the one constant hub, and people will sometimes shop between different pharmacies because your connection with that person or that team or that service, but particularly if I think of sleep apnea, for example, I know some people that have changed pharmacy because of sleep apnea, that they've now gone to a pharmacy that specialises in that. So for anyone listening today, I guess the summation and the wrap up today is that pharmacy teams are already doing this, as we said, subconsciously. Pharmacy teams have so many things thrust at them, both from a business and an industry and a supply perspective, that it's sometimes easy to park things. But in my mind, the reality is that when it comes to customer connectivity and association, this is innate. This is already happening. And if you're listening today, here is potentially an opportunity to reach out to yourself and have the chat. And as you've said, connect, whether it's a webinar with you and your team, to actually progress this as a service, extended service to your community. Jenny, we've come to the end of our time, and there's certainly an opportunity to have another chat in a few months' time about what's happened, what's changed. But I'd really like to thank you for your time today. It's been a great chat. As I mentioned before, we'll attach your contact points in the show notes attached, and I look forward to staying in touch. Thanks again for your time.
Thank you so much. It was a pleasure to chat today. Take care. Thank you.
Thank you for listening today. Pharmacy View is a technology-focused podcast provided by Melbourne-based business Arian Technologies and Shopfront Solutions. Over the podcast series, our guests include pharmacists, retail managers, wholesalers, suppliers, and industry technology partners. If you would like further information on our podcast series or to participate in one of our episodes, feel free to send me a message or touch base through the Pharmacy View website, pharmacyview.com.au.